Since lung cancer has been a leading cause of cancer death in the United States, the evolution of diagnostic tools such as bronchoscopy has been ongoing since I started my practice. With the Franciscan Health commitment for the best care for our patients, we started using the more advanced tools of bronchoscopy, which is lead us to doing navigation and bronchoscopy, robotic. The name is Ion Robotics, and it will help us actually early diagnosis for lung cancer as early as stage 1 when the nodules are very small, and that has dramatically improved the diagnostic yield, the early detection of lung cancer.
Any patient with lung nodule, small or big, for diagnostic purposes will qualify for robotic bronchoscopy usually, even if they are already on oxygen or if they have significant lung disease, they'll be able to usually tolerate the procedure because risks of procedures are minimal. So usually when we do robotic bronchoscopy, we have a cytotech on site with us. They look under a microscope, they tell us we have cancerous material or not. Whenever we find cancerous material, we'll proceed with the same time with a procedure called endobronchial ultrasound or EBUS, and we biopsy the lymph nodes. If they are negative, usually this patient might be a candidate for surgical resection. That would be an early stage lung cancer.
So as we all know, it's that not all nodules, even in high-risk patients, is cancerous. Actually, the majority of nodules is not cancerous. So if a patient, the diagnosis came back to be lung cancerous or what we call granuloma, is basically the best option at this time is to basically monitor the patient very closely. So we have a tumor board. We meet and discuss all the cases and figure out what's next step for patients. Usually we monitor these nodules very closely until we decide if the nodule is benign or needs further testing needs to be done.
So the good thing about the cancer center, everything in one area. We have PET CAT scan, we have radiation therapy. So if we have lung cancer, which is early stage, if they are not a candidate for surgery, we'll send them for radiation oncologist and oncologist treatment, which would be in the same building.
What I really like our primary care providers to know is that our robotic bronchoscopy is basically a non-invasive mean, and the complication rate very low, and the yield is very high as 94% to 95% for diagnostic yield. That means when the patient has a bronchoscopy, very likely that we're going to have a diagnosis without getting the patient into second procedure or repeated procedure, which we have done in the past with the traditional bronchoscopy. And that, of course, makes it much better for the patient care, including early detection of the lung cancer and initiation of treatment, which makes a difference as early as possible.